So I just did here's some fun facts. See if people enjoy these facts as much as I did discovering them and reading them. So in 2025, there were 47 standards in the PC chapter. In 2026, they've reduced that to 31 standards. So in that, they've deleted 62 EPs, and some of those. Now, see, it sounds really good when you say that. Gosh, 62 EPs were deleted. But wait, there's more to the story. Of those, 42 were deleted but replaced with more direct EPs or moved to the guides in the survey process guide. And then 13 are going to be, well, okay, 7 totally deleted, 42 deleted and replaced with more direct EPs or moved into the SPG guidance. And then 13 are going to be replaced with more direct EPs with CMS approval. So they're still waiting to add some more pending CMS approval. Most of those revolve around maternal standards. And we already heard previously that they're doing some changes with looking at those maternal standards. So that's not new. So of those EPs in the PCs, 4 were moved to completely different chapters. So they moved from the PC chapter to 4 different Joint Commission chapters. One went to record of care, one went to rights and responsibilities, one went to nursing service, and one went to leadership. And then they have, this was fun to do because I just took it and color coded everything. So of those, they moved 26 of those EPs to the National Performance Goal chapter, and Edwin will talk more about that. And of those, when they talk about it, they moved 24 of them. They call them moved and revised. One was just moved. So those, I take it, when I read that they're just moved, I would say that their language matches word for word with what the COP's language is. So when they just say moved, so they just picked it up and moved it and it remained had the same language. And then they moved and consolidated one. And that's an example of consolidation is under patient identification. They had one just under general, how do you correctly identify a patient? And then they had the same standard or the same EP for how do you correctly identify someone that's receiving blood. So they consolidated that into one EP, which makes sense and I think is great.
Yeah.
But the bulk, they renumbered a whole bunch of them, but they remain in the PC chapter. Of those, 102 were renumbered but remain in the PC chapter EPs. 60 were moved and revised, meaning they had some language tweak. 32 were just moved so that the language matched word for word with the COPs, and then 10 were consolidated. And of those that were consolidated, most of those had to do with the plan of care. And then there's still more. There are more, they have some new EPs under the PC, and that came from, they're just aligning their language to align more closely, and I would say word for word with what the COPs say. And of those, when I delved in, I didn't read all of them. It's just, sometimes the language gets a little bit boring. Of those, I know, I can't believe CMS sometimes gets boring. I have to work on that. I think they should hire me as a writer. It would really make it liven it up a little bit. But anyway.
I would vote for that.
Yeah.
But of those, most of those have to do around the plan of care, the ones that they're rewriting. And I want people to pay particular, because language is important, and CMS language is especially important. And one of the things that they're emphasizing, I think we talked a little bit about this, is that the hospital involves a patient in the plan of care. And they're looking especially how is that involvement and how do you document that involvement. Now, I think what most of us would always, especially from a nursing perspective, we always involve the patient in the plan of care. But I'm thinking that they're wanting something a little bit deeper in that that patient knows what that plan of care is and what it says and what the goals are. And usually we've surveyed that plan of care by asking the nurse, what are the plans? What was your assessment? What were your interventions? What's your plan of care for that particular patient? And the nurse answers it from her perspective and her documentation. not necessarily with the patient being able to verbalize everything that was on the plan of care. I think that they're expecting a little bit more involvement with that. Now, some things might still count. For example, when you go into the room and there's a care board and you see that there's a discharge goal, right? The patient is involved in that. That goal is right there. It's written. The patient can speak to it. But I think that CMS, especially with emphasizing that the patient's involved, is looking for a little bit more, that the patient has a little bit better understanding of the overall plan of care and what they're doing and goals of care. And actually will help set some of those goals. We've had a little bit of practice at with pain goal. I mean, we're very used to asking the patient, what is your goal for pain relief, and involving them in that way. I think that they're just expanding on that picture.
Yeah.